The shared prosperity funding allowed us to start to bring in organisations who could actually help take this forward. Local schools are now involved in that partnership, and the Primary Care North team. We were fortunate that Helen Davis had already been working with Kat MacLeod from the PCN, and Kat agreed to come to one of our meetings. And through that work, we formed what we called the Small Steps to Feeling Great. So it's a statement that says we've got a destination which is feeling great. We've got to take people on a journey. The partnership itself is being on a journey. We're all coming from different backgrounds, different angles for this community, but we have one focus when we sit around that table, and that is about health and well-being for 12,000 people who are in this parish. In the partnership, it's been really important for people to be creative. I think working together has allowed us to be creative and think of different ways of working that we would not have considered had these different organisations, come together for this one purpose. A lot of organisations are very institutionalised, and restricted. Resident-led organisations, we're a CIC, or charities don't have those same restrictions. We can learn from each other. As a resident organisation, we've learned how difficult it is for the NHS, for the District Council, to come and sit around that table and try and work around their own restrictions, but they have done that. People have had to kind of leave their ego out the door and kind of go, it's not about us, it's about all of us. Actually, it's about all of these residents. So we have to really take ourselves to task and say, there's got to be another way. And that's been the beauty of the collaboration. Having Kat being part of this Small Steps partnership opened our eyes to the fact that there are more people in her team. So we've had an opportunity to now understand what her team does and see how we can work together. For example, Anna coming into the Health Hub to do the seated exercise. We've got cross referrals, so we've got people who can join Vicky's Pilates classes. Vicky may know people who need that seated exercise. Through our coffee mornings, we talk to people who would not have considered coming into the Health Hub, but they meet Anna and they're sold.
Well, I work for Mansfield North PCN and I'm a health and wellbeing coach. So we work with patients who have got long-term conditions and we look to help them help themselves. So lifestyle change, behaviour change, and just so they can then go on to lead a full life as best they can. So all the sessions previously, everything I've ever done before is about people coming along and wanting to be physically active. And I think the difference now is targeting patients who feel they're not able to do that and need the confidence built to be able to come along and think, this is for me. We work quite closely already with Serco Leisure, so we refer people onto the Healthy Life referral programme, so increasing their activity there, but we also work now with Vibrant Warsop and working closely to identify what they can see that's needed out in the community, and if we can facilitate something working with them, then we're happy to try anything.
The Warsop Health Hub is one of the things I've been most proud to deal with as a clinical director in Mansfield. One of my embarrassments is that it took me 35 years as a doctor in the NHS to realise that the answer to our problems doesn't lie in hospitals. It doesn't lie in expensive drugs. It lies in places like Warsop Health Hub. We really have to get upstream and try and prevent problems happening in the very first place. And I think until we do that, we're going to continue to be overspent. But I'm very, very optimistic because of the great community we're in now and the great work that's being done at Warsop Health Hub. One of the great things we've achieved locally is work between Mansfield North PCN and Rosewood PCN, to be fair, to work alongside Mansfield District Council and their leisure services, and that we can get easy access to healthy activities. And healthy activities are the key to absolutely everything we do in the NHS. All the long-term conditions I spend a long time treating could be certainly prevented by work we're doing here and certainly controlled much better. So we're really changing culture now, and for too long there's been collusion between, I think, doctors and patients to try and, this is a medical problem, let's sort it out the medical way. And actually, once patients get into the system, they actually realise that taking responsibility and realising that some of the ways we all live are really not good for us and probably not acceptable long term, and they really do buy into it. And that's probably one of the most rewarding things I've seen recently.